Good afternoon. Thank you, Professor Tiki Pang, and thank you to the organizers for inviting Malaysia to share our how we do things in Malaysia. And I have 15 minutes, so what I'll do is that I'll just brush through some of the very generic processes which actually has been discussed. I understand the last 2 days we were here. What I'll focus on is how we actually one example that, for the HPV vaccine that we've just procured and implemented, and what are the issues with the 2 new vaccines that we are introducing very soon. This is very generic objective of immunization program in Malaysia, and I'm sure it's the same for many countries, and that's to protect people against diseases and ensuring accessibility of the immunization services, and as well as ensuring that the quality, equity, affordability, efficiency. Besides the triangle that was seen today, we must make sure that it's also technologically appropriate within the context of Malaysia, and that it is consumer friendly and acceptable to the population. So the aim here is to sustain, as far as the government is concerned, is to sustain high immunization coverage. The moment we introduce a national program, one of the commitment that we must make is that the coverage must be high, otherwise we are not going to do justice to the investment that we've just made. And particularly this, the coverage must ensure that we reach the unreached population. Of course, besides introducing new vaccines or new technologies related to immunization, we also would like to reduce the not only the mortality, but also the morbidity, especially now we are moving on to SDG 2030. Whilst 2030 SDG objectives are very, very generic, very general, we've just sat down and actually we've already teased out what are the specific targets that we want to achieve for 2030, and definitely immunization is one of them, because we've had some recent spate of outbreaks and even deaths, and that is something that the country is very concerned with. As I mentioned, the commitment is like, once you commit, once you've got it down, it must be 95% and above. And yes, the government focuses on childhood vaccination, but we do not dismiss the fact that as some adult immunization has also been introduced where it is important. And to get all that done, the MOH has to ensure the capacity is adequate and the capability is there, besides all existing issues or strategies to, if there is any VPD outbreak responses, we must be on our toes, and the strong surveillance capacity and monitoring. So this is what we've been doing for the last few decades, and it actually started in 1956, just prior our independence in 1957. We've been introducing several vaccines along the way, and only the green and the red is yet to be decided, and I will discuss that towards the end of my presentation. So the black line is the childhood vaccines, while the green lines are others vaccine, which is for the adult, and of course the HPV is included in this line. But there are other vaccines, like when we have some the recent outbreak for flu, and to name a few. So this is the National Immunization Schedule, and I don't think it is very different from many countries who've started this. But perhaps this is an important slide to appreciate that this is the infant mortality and under 5 mortality rates, and those are the interventions that is written vertically across the graph. The ones in red are the immunization or the vaccines that have been introduced. Those are the years in which the vaccine were introduced, and we have not stopped until today with the HIB, MMR, IPV, the new IPV, and of course the HPV latest in the list. So what are our approaches to introduction of new vaccine? Of course, I think this is quite given to any country. What is the disease burden? How do we assess? And even if we do agree that is the disease burden, and that is something that is important for the country to address, do we have the necessary strategy, the advocacy, the effectiveness, the capacity, and to look at the possibility of implementing it strategically? And will we be able to leverage on the existing monitoring and surveillance mechanism, or do we have to start all anew? And definitely the regulatory, registration, vaccine safety control are all in the framework to ensure that these approaches are met. The steps are met. So when we talk about the policy, which vaccine, what diseases? So this situational analysis of the various diseases in the country is an ongoing process. And this is not just immunizable diseases, but all diseases. And this is the disease control program that is being discussed in the cabinet meeting, and even in the post-cabinet meeting, that is a meeting that is chaired by the Minister of Health, which is a weekly affair. So some of these diseases are discussed, and these are taken up, whether it's an issue or to be a proposal to the higher-ups. And it consists of disease control, prevention, and eradication will be discussed. And then for VPD, we will look at the performances. And there are a lot of times, there are some, particularly measles, we are not doing too well. And that's a great challenge actually for Malaysia. Otherwise, all other immunization, we are doing pretty good. So in terms of implementation, we're looking at the strategy of service delivery, procurement, logistics. Like recently when we had the spat of measles outbreak, our greatest concern was the vaccine that was the problem, or was it the logistic was the issue, or was it the way that our nurses that was giving, it was quite a very tough needle finding kind of issues. Where did the problem lies, because some children were immunized at least 2 doses, and yet they succumbed to the disease. We had DPT outbreak as well as measles outbreak, sporadic outbreak, which we had, unfortunately, 2 deaths. So that really, turned us off, looking at where did we go wrong. So again, we have to go upstream, where did we go wrong? And there's a lot of discussion in terms of the management and the monitoring processes, and we have to really look at all of them. In terms of regulatory control, we have the National Pharmaceutical Control Bureau, which oversees the registration of new drugs. And of course, they look into all these elements, which we are very aware of. We have continuous quality control and research. We have what we call as the Institute of Medical Research that does the various researchers on the VPD and other diseases that are assigned to them. So we also have a department to look at the testing of vaccine and also vaccine research development. So what are the committees that are involved when we want to introduce a new vaccine? This is a committee that is actually chaired by the Director General of Health, and they have various departments or task force that looks into the pharmacovigilance, on safety of vaccines, the new vaccine development and usage, health education and promotion, implementation and vaccine use and cost. And this committee sits every 3 months. So it does not just look at new vaccines that have been introduced, but also, the existing program. And we will look at all the elements that has been mentioned up here. So what is the flow process on introducing new vaccines in Malaysia? Now, this is a bit on an old flow chart, but I think it's still relevant. Number one is, of course, whether it came from a WHO resolution, or whether it was a new research assessment, or whether it came from a proposal from a professional body. And I just want to inform you, like for HPV, it came from a very strong NGO push. So now from that, then we have the proposal brought up to the National Technical Immunization Committee, which, if they agree, will then go to the next phase of studying the benefit implementation issues and sustainability. And that sometimes this can take up to 2 years. And for the pneumococcal, it's been quite long now. For the dengue, I think it's still within the 2 years. So this is again presented to the committee, and if all goes well, then there will be an agreement, which will then the proposal will then be forwarded to the Ministry of Finance for the fund allocation once this is approved. So what I like to focus on is an example here. Now, at the moment, we are having question mark for the introduction of pneumococcal dengue. And prior to that, let me just explain to you how the HPV immunization process takes place and how it got introduced in Malaysia. First, we look at of course, we were looking at what are the opportunities and what are the threats. And on your left-hand side are the opportunities and strength. We have the vaccine. There is an energized medical, social experts. There is a very, very strong lobbyist because the former PM's wife died of cervical cancer, and that was, a very strong lobbyist group. And of course, we have a pretty receptive cabinet actually when we talk about health issues. So the list goes on the left-hand side, but we are not, we cannot be complacent about the threats and weaknesses we are having. And we heard this afternoon from Pauline. Whatever she had said, it is exactly that it's happening in Malaysia. We have all the problems which she has just alluded. The religious issues, the promiscuity, and then this homeopathy and the natural practitioners. We have all that. So one mistake, as Paulina said, one mistake can flip the hard work that we have done all this year. So we were very careful in really parading these vaccines. Another difficulty is that when Malaysia, as I mentioned to you, when we commit, we want to achieve 95% within that cohort. So we have chosen 13-year-olds as our cohort, and there is only a short window period in a year schooling period. It's about only 6 months you can go in and out, because they will be having exam and they will be having their co-curriculum and so all that. So that was another challenge. How do we use the existing resources? We have to, at the same time, there is aggressive social media. We heard today as well. Now, cytotechnician and gynae oncologists are saying, hey, will there be work for us? We heard this just now. Oh, I know it sounds ridiculous, but people raise this up as well. So, again, how did we rationalize it? Of course, the cost effectiveness study, but I think we have not gone the extra mile of getting those non-health determinants or non-health benefits. But it was adequate enough to see that if you have cancer cervix, the amount of millions that you've got to spend versus the HPV vaccination, the number of millions offset, it is more cost effective, of course, to have the HPV vaccination, even though at that time, HPV vaccine was one of the most expensive vaccine around. Okay. So as you can see that the decision-making planning process is not simple. It's not something that is a knee-jerk. It takes a very long time actually to decide. Just to give you an example here, it started from 2006 when actually the proposal came from my department because there was a lot of women NGO pressuring, and so we found that this is an important opportunity actually. And then in between those 2 years, we had approval, we had the negotiation, we had the studies done. And then in 2010, in fact, within a period of 6 months, suddenly the Minister of Finance said, here you are, 30 million, go ahead. And we had only 6 months to implement, and voila, within that 6 months, we achieved 95% coverage as promised. So we have to decide what were the goals, and then strategies and operational, and I think the rest is something that we are familiar with. It's just I want to show you that we have a peculiar, and I'm not sure if GSK is happy here. We have a peculiar relationship. How many minutes now?
No.
I'm okay?
You're okay.
Oh, yeah, okay. All right, thank you. All right. Okay, so we had Savarix in the first 2 years, and then now we are on with Gardasil. But because of this competition, and I have to say this in the light of being from the Ministry of Health, we had a good negotiation opportunity actually. So, and also because of the tier packages, probably the cost actually reduced almost half. And that was one reason why the Ministry of Finance actually approved this program. So communication strategies is key, as was mentioned. How did we get, in fact, a lot of people do ask us also, how did you do it within 6 months? You got the next year 95%. I think we were very meticulous about how we want to approach it. We made sure we have all our bubble diagrams and what were the risks and how do we assess and looked at them. And I think in Malaysia, knowing religious issue is one of a contentious issue. That is something that we address right up front. So we gave the halal vaccine the religious interest up front, so there was less and not so much of an argument from the community. So what are the key factors? I think this is something that we all are very aware. So next, what about pneumococcal and dengue? Okay. Now, for pneumococcal, there is a lot of discussion, and we've done, I think, layers of studies. We've even done the mapping, the strains, and then we've done look at the cost effectiveness. And we are actually almost at the level of getting it approved. But I just got from a message from a friend, we are thinking about rotavirus now. I'm not sure whether it was Umesh. I didn't SMS, don't worry. So it was something that, so they are now, because you see, the problem that we are having is in a year, every year, at the end of the year, we always submit what we call as new policies. And each of these policies introduction is based on some analysis and some, important areas that we need to address. So, for instance, this year, pneumococcal was supposed to be considered last year, but this year we had thalassemia program that came in. So that, sort of overtook the pneumococcal. So we have a lot of competing priorities. And again, pneumococcal this year, I'm not sure if rotavirus is going to overtake that instead of the one that we introduced, because as you all know, it is pretty costly. So this is a study that was done. What about dengue? I think some of you are in this area do know that Malaysia, I'm not sure whether it's premature for me to say this, but I think it is licensed already in Malaysia within the 4 walls. So no SMSing. So we are now going into phase 4 post-licensure study. It's just that we are stuck. Was discussing with Prof. Tiki, what can I say and what should not I say? Okay, what I'm going to say is, for instance, our problem is, do we, in the interest of the disease that is ongoing, do we look at the adult group so that we protect them? Or do we don't mind with the investment of going through the young group? Because we don't have the luxury and the kind of funding Brazil has. Brazil can go through all the age group. I don't think Malaysia could afford that. So, trying to weave out this very important and deciding on which target group is still in our debate. So, in summary, does the full public health value of vaccines being appreciated in Malaysia? I think we do. It's just that we have not put the numbers and the way, forgotten. JP, sorry, the way JP has done it. Firstly, I think we could say that vaccination is most effective means of controlling infectious diseases, and I think by doing that alone, we can know what the value it has brought to Malaysia as far as Malaysia is concerned. And making a vaccine program equitable, sustainable, efficient, and safe. You know, in Malaysia, when we talk about introduction, it's 95%. And not less. And we've achieved that. In other words, we've gone through the mountain, to the rivers, to the sea, and to the jungles to look for these children, because it is part of our KPI, key performance indicator. And we are happy to note that the successful implementation with strong advocacy, collaboration, and commitment from all parties increase the vaccination acceptance of the community. There is a lot of trust to the Ministry of Health when we introduce a vaccine, and we could see that, you know, each year they do not fall out from the introduction of new vaccines. So Malaysia is receptive to introduction of new vaccines, and we have to look at these two areas, the narrow health benefits and the broad non-health benefits. I think to look at the existing vaccines, as was discussed today. Do not forget about the existing vaccine, what are the benefits, and of course the new vaccines that's to come. Thank you very much. And